Here's the way it works. Let us assume that 6 people out of 100 have athlete's foot. And so you give them green jelly beans, and now 4 people out of 100 have athlete's foot. So what is the absolute risk reduction? 2%, right? We went from 6% to 2%, to 4%, which is a 2% reduction. Unfortunately, that will be reported in a medical journal as a 33% reduction because 4 is 33% less than 6. You understand what I just said? So in the journal, it will be reported as a 33% reduction. Now let's assume that we have 6 people out of 10,000 and you give them a drug and it drops to 4 people out of 10,000, it will still be reported as a 33% reduction, even though the real number is 0.000 however many out there to 10,000, right? You understand the difference? So the bigger the study, the easier it is for them to lie to us about the effectiveness. So unfortunately, essentially all medical studies now are reported that way. And so you don't have any idea of whether or not the therapy that they're trying to talk to you about was effective or not unless you go back and actually read the numbers in the study and do the math yourself. And that is the reason that they were able to convince us that cholesterol had something to do with heart disease, which it doesn't. So this group at Hopkins decided, let's make it visual. And so here is a diagram of a theater with 1,000 seats in it. Here is the annual deaths per 1,000 from heart attacks as compared to mean cholesterol. So you can see that here, if your cholesterol is 150, that then you have 2 deaths per 1,000 at that level, whereas if the cholesterol level goes all the way up to essentially 300, that you have 2 per 1,000. So how does that graph out? Well, out of 2,000 people with elevated cholesterol, there will be 1 additional death each year from coronary heart disease compared to 2,000 people with normal cholesterol. And that's this one little guy here sitting in 2 theaters with 2,000 seats. Kind of impressive when you look at it from a visual standpoint, right? So what it means is that for 99.95% of the population, you will not benefit from any effort, diet or drugs, to reduce blood serum cholesterol levels. Put it another way, for 1,999 out of 2,000 individuals each year, it makes no difference whether you have elevated cholesterol or normal cholesterol in terms of whether or not you develop coronary heart disease. Did you know that? So why is it that when you go to your physician, your physician will almost have a stroke if you tell them that you don't want to take statin drugs? And many times patients come to me and say, well, I told my doctor I didn't want those drugs and he told me to get out of his office and not come back. I hear that over and over again. Physicians are so aggressive about trying to make people take cholesterol drugs when the literature shows that they're totally ineffective. Well, how about the H1N1 flu? You'll remember that this H1N1 flu